Islamic bioethics approaches CRISPR gene editing technology through a well-developed moral framework rooted in the Quran, the Sunnah, and centuries of legal and ethical reasoning. Rather than asking whether science should advance, Islamic ethics asks how scientific power should be exercised in a way that honors divine intent, human dignity, and communal well-being. At the center of Islamic bioethics is the preservation of life. Human life is regarded as sacred, and protecting it is one of the highest moral obligations in Islam. Because of this, medical interventions that prevent serious illness, reduce suffering, or save life are often viewed favorably. When CRISPR is used as a therapeutic tool, for example, to correct a genetic disorder that would otherwise cause severe disease, many Muslim scholars argue that such use may be morally permissible and in some cases even commendable. Closely connected to this is the principle of prevention of harm. Islamic ethics places strong emphasis on avoiding actions that cause unnecessary injury, suffering, or corruption. Any use of CRISPR must therefore demonstrate not only potential benefit, but also a high level of safety and proportionality. If the risks of harm outweigh the benefits, or if the long-term consequences are unknown, Islamic ethics urges restraint. Another key principle is maṣlaḥah, or public interest. Ethical decisions in Islam are often evaluated by how they affect the welfare of individuals and the broader community. If a medical technology promotes public good, such as reducing the burden of genetic disease across a population, it may be viewed positively. However, if it threatens social justice, increases inequality, or introduces moral corruption, it may be restricted or prohibited. Despite this openness to therapeutic use, Islamic bioethics draws clear moral boundaries. Genetic enhancement, especially for non-medical reasons, is generally treated with skepticism. Editing genes to improve intelligence, appearance, or physical traits raises concerns about arrogance, injustice, and the misuse of power. Such enhancements risk privileging wealth and status, undermining the moral equality of human beings before God. Particular concern surrounds irreversible hereditary changes or germline editing. Altering genes in a way that affects future generations raises serious ethical questions. The absence of consent from descendants, the permanence of genetic alterations, and the potential for unforeseen harm. Many Islamic scholars argue that such interventions exceed legitimate medical necessity and should therefore be avoided. Underlying these concerns is a theological caution against altering God's creation without necessity. While Islam does not oppose medicine or scientific advancement, it warns against modification driven by vanity, domination, or excessive control over nature. Healing is viewed as cooperating with divine mercy. Unnecessary alteration is viewed as a form of moral overreach. Importantly, Islamic bioethics does not rely on a single authority issuing universal rulings. Ethical judgments about CRISPR often depend on scholarly consensus, interdisciplinary consultation, and case-by-case analysis. Physicians, scientists, and religious scholars work together to assess intention, necessity, risk, and benefit before arriving at moral conclusions. In summary, Islam does not reject CRISPR technology outright. Therapeutic gene editing aimed at preventing serious illness may be permitted, provided it meets strict ethical conditions. Enhancement, germline modification, and unnecessary alteration of human biology, however, are approached with strong caution. For Islamic ethics, the guiding question is not simply what science allows, but what faith, reason, and moral responsibility together demand.